In this segment, we're going to show the recommended technique to successfully bond to hypocalcified enamel, fluorosed enamel, aprismatic enamel, deciduous enamel, saliva-contaminated enamel, dentin, and bleached enamel. All of these situations can be handled with the use of a Sure universal bonding resin, which is a combination of the enhanced adhesion booster chemicals and bonding resin in one bottle. The technique is as follows. First, a thorough prophylaxis using a rotary instrument. Rinse and dry. Acid etch with either phosphoric acid or a self-etching primer. If a self-etching primer is used, be sure to lightly dry at the conclusion. Application of the Assure. Dispense a drop of the Assure into a mixing well. Pick it up with a brush or sponge pellet and apply one coat per tooth. Stroke over it several times to make sure we have good coverage and penetration. Lightly dry for a couple seconds, not to thin out the Assure, but to evaporate the ethanol, which is the solvent that carries the chemicals to the tooth. At this time, check to see that the enamel is shiny. If the enamel is shiny, then you can proceed with the application of the bracket with paste. If the enamel is not shiny, still dull and chalky, then apply a second or third coat and dry after the last coat only. The bracket at this stage can be placed with any light cure, chemical cure, or dual cure adhesive paste, regardless of manufacturer. Bonding to dentin. Bonding to dentin is very similar to bonding to enamel. We're going to prophy, rinse and dry the surface. We're going to acid etch for 30 seconds. We're going to rinse and dry but not desiccate the dentin. We're going to leave it moist. Then we're going to apply multiple coats of the Assure bonding resin and lightly dry after the last coat only. Then apply your bracket with paste. Bonding to bleached enamel. If a patient has had a bleaching treatment within 2 weeks of his or her bonding appointment, the residual peroxide layer can interfere with the etching mechanism. So we need to neutralize that peroxide layer. And the way we do it is with ascorbic acid. We get the ascorbic acid from a vitamin C pill. Take a vitamin C pill, crush it, add water to it, and then do your prophylaxis with that, and allow that slurry to remain on the enamel surface for at least 60 seconds, thereby allowing the ascorbic acid to neutralize the peroxide layer. Rinse and dry thoroughly, then acid etch, rinse and dry. Apply 1 to 2 coats of Assure and lightly dry after the last coat only. Then apply your bracket with paste.